Good morning, everybody, and welcome back to another video of all things vet med. I'm super excited for what I have in store for you guys today. I'm going to be bringing you all with me to work in the emergency veterinary hospital near my house I live in Berkeley. So I'm really excited to share this one with you guys today. This morning is going to be pretty busy. My shift starts at 8 a.m. and I immediately start working right with the doctors. We're gonna have doctor's rounds in about 10 minutes at 8 a.m. And this is basically where I take really detailed notes on like the patient's breed, age, their previous medical history, as well as the medications that they're on, the reasons for why they're in the hospital, and the treatment plans that we're gonna be doing throughout the day. So it's definitely a lot of information, and the doctors really have to trust in their technicians to make sure that they're getting everything done properly. You know, we always are changing fluid rates. We're always changing, as I said, medications. We need to know when we're pulling blood work. We need to know how critical each patient is. And for that reason, it can be sometimes overwhelming, but with practice makes perfect, and I'm getting better at it, and it's going really well so far. So hopefully we don't have anything too critical in the hospital today, but I'll keep you updated as the day goes on. Excited for you guys to join me today, so let's get going.
Make sure to get pet insurance for your young dog so they don't end up at the hospital like this one with a toy in its stomach. Here's another young dog that came in for having diarrhea, one of the most common symptoms that we see in the emergency room. Sent him home with some antibiotics. This was the best cat of the day because it did not try to kill me. I have pretty bad luck with the cats. This poor girl's probably thinking, what are my chances of escape if I just jump out of here right now?
Hey guys, so just checking in. It's 12 o'clock. We've been at the hospital for about 4 hours. It's been a pretty smooth shift. Nothing too crazy happening. I'm working inpatients today, so that means we have hospitalized patients that I work with, and we have one that's having difficulty breathing. It's a younger dog, so we have him on oxygen. We have another patient with something called a urinary obstruction. Humans get it too, but we have to be constantly monitoring this is a cat in this case, the cat's bladder, constantly removing urine, taking x-rays, rechecking on an ultrasound. Sometimes we have to sedate it, put a new urinary catheter in. I can talk more about that in another video, but right now I am coming up to 7-Eleven, my daily stop, because I need the goods. All right, here it is. Sparkling water. If you know me or any of my friends are watching this, I love my sparkling water. So around 1 o'clock every day, I'm walking up the street, coming to 7-Eleven, and maybe grabbing a bag of chips or something and getting myself sparkling water. Keeps me hydrated for the rest of the day. But I'm about to get back to work, and I'll see what else I can share with you guys. Quick view, this is the x-ray room. This is the fancy machine we use. I'm wearing a mask because I'm inside, but it's pretty cool stuff we can do with this. Take all sorts of different x-rays to see broken bones. We just took one on that dog I was mentioning, and the one that's having difficulty breathing, and we can see that it actually has pneumonia, and it's not responding to antibiotics, so probably gonna have to send it to internal medicine for a more in-depth case.
Every afternoon, we have a board-certified radiologist come in and do a ton of echoes and ultrasounds on our patients. It's a nice break because otherwise I would be running around the hospital 24/7. This behemoth of an animal came in because it unfortunately fractured its spine and is now paralyzed and can't hop on its own. This cute dog, on the other hand, I actually have no idea why it came in because it wasn't my patient, but super cute, so I thought I'd take a video of him. Swollen back leg, I think. Sometimes, no matter how hard you try, you just can't be friends with all the animals.
Hey guys, what's up? So kind of an unusual day in the ER today because I'm actually getting off 30 minutes early, which is pretty bizarre. I'm normally there at least 15 minutes to an hour after shift, helping out if there's any critical cases coming in, or if someone comes in late, or sometimes treatments just take longer than you anticipate. So it's really nice that I'm out of work early. This is really rare, so not a typical day in that sense, but got to see a lot of cool things in the rest of my shift. I guess had to help with a lot of ultrasounds, just for straining, and I'm helping with the doctors do that. Had to take more x-rays. A couple of our patients are going to have to stay extra overnight. Not all of them are going to get home, so that's why we have our swing and overnight shift that comes in. They work tirelessly all evening to give medications and run blood work and do treatments on the patient. So kudos to them. It's really difficult to work those hours. I hope I don't have to do it a whole lot, but I'm sure in the future, if I specialize or go into an internship, it's going to have to happen. But for now, I'm enjoying getting off around 5:30. Normally get off at 6, so that's nice. And I guess I'm going to try to go on a run, or maybe go to the gym, and then probably make some dinner and watch some Netflix or HBO or something like that, and then maybe get in the hot tub before the night's over. So glad you guys joined me for today's video. Hope I can do more of these. I'm limited in what I can show in the hospital just because I haven't really gotten a whole lot of permission yet. So I'm just showing little bits and pieces that I can here, but hopefully we'll make another video soon, so stay tuned. All right, have a good one, guys.